Hi, my name's Darren from Go-To Imaging, and I just wanted to share up another case history that of a patient I saw not long ago, about 6 months ago. And it just kind of proves, as I've kind of gone on the case history page, how important it is to understand your own patient's images. So just going to share you the screen here, and we have a patient who has been suffering with, like I say, left leg sciatica. And she went and saw a therapist who did 10 treatments of therapeutic ultrasound. Now, this therapist believed that this patient had a disc prolapse or a disc herniation, which was affecting the sciatic nerve. And they thought by doing the ultrasound, it would help to reduce the inflammation around the nerve, and it would equally help to calm things down. Unfortunately, she had 10 treatments of the ultrasound and it never worked. If I'm honest, ultrasound is not very good for disc lesions because it cannot sort of go beyond the depth of the bone, obviously, the lamina especially, and the facet joints, where behind is where the nerve is. So kind of wasn't an ideal treatment to do at the time. She wasn't improving, so she came along for a second opinion. I sent her for a scan, and I must admit, on clinical examination, I equally would have thought that based on her symptoms and sciatica, it was likely that there was a pinched nerve, most likely to do with a disc. But here you can see why it is so important. She'd suffered for 6 months, by the way. Now, you can clearly see on this view here, now this is a sort of sagittal, parasagittal view. And what we're looking at here is this little tissue. So here we have a facet joint and another facet joint, and in between is what's known as a high signal. Now you can clearly see that that signal is slightly brighter compared to the facet joints above and below. And if you look to the right-hand side of the screen, you can clearly see this is an axial view, so a cross-section view, and here is the disc, L45, and the facet joints either side here. Now, what I was expecting was to see was this disc potentially leaking just here and compressing this grey structure here, which is the descending L5 nerve root. You can see on the right side here that actually the nerve root is, as it is, it's not being compressed. But this one you can see is slightly deformed, and it's deformed because there is this high signal here, this lobule, which is extending from the left L45 facet joint. So this is actually a facet joint cyst, and that has come about by degenerative change or just a distension of the capsule, and it has indented the descending L5 root, and this is what was causing the patient's sciatica on the left side. So we sent her to a consultant radiologist who did an intervention of saline under high pressure and literally burst that cyst, which then allowed the pressure to become reduced, taking it off of the descending L5 root, and her sciatic pain completely went away. There you go. Thank you.